What's going on, guys? Medicine in 3 minutes back here with another video, and today we're going to be talking about diabetes insipidus. We're going to keep the subject clear, brief, and illustrated, so let's get started. Now, when we're talking about diabetes insipidus, it's going to involve the pituitary gland. Now, the part of the pituitary gland that's going to involve is not the anterior pituitary ACTH. We're actually going to be dealing with the posterior pituitary ADH. As you can see, it's located right behind the nose at the bottom section of the brain, as you can see in this general location. So the ADH, Antidiuretic Hormone, is produced in the hypothalamus and is stored and released by the posterior pituitary gland. So that's what we're going to be dealing with when it comes to diabetes insipidus. Now, when we're dealing with diabetes insipidus, we spoke about how the anterior pituitary gland is not involved. Now let's find out why the posterior pituitary gland is involved. Now, the first thing we need to know is that the ADH does act as a control towards the kidney. It lets it know how much water to exert in the urine, and it acts as a stop. What happens is there's a lack of secretion of this hormone, the antidiuretic hormone called ADH, and when there's a lack of this hormone, there's actually going to be an excess in urine that comes out. So, in other words, if for some reason the disease does appear, the secretion or response to the pituitary hormone vasopressin is actually going to be impaired, which, like we talked about, is going to result in the production of a very large quantity of a diluted urine, and which often is going to lead to dehydration or like an unquenchable thirst. Okay, now when we're looking at causes, now there's going to be three things that we're going to look for in the history that could cause diabetes insipidus. The first is going to be head trauma. So if there's been any head trauma in the past, this could be one of the causes. The second is going to be a pituitary tumor. And the third is going to be craniotomy. Now, when we're dealing with symptoms, there's going to be a lot of symptoms that we're going to find. The first of which being thirst, obviously. There's going to be a lot of liquid leaving the body, so that person is going to feel much more thirsty than they would normally. The second thing is going to be tachycardia. So that's essentially the heart rate going up very rapidly and maintaining a very high rate. The third is going to be hypovolemia, up to 20 liters of urine a day, so just a very large quantity, again, leaving the body. There's going to be a low blood pressure, low specific gravity, and low osmolarity. Now, when we're looking at how we're going to manage it, when it comes to nursing, you are going to want to monitor the fluids, so make sure to keep track of the fluid levels in the body. You're going to want to replace fluids, and you're also going to want a neurostatus, so keep track of a neurostatus and check for vital signs. That's going to be very important as well. Now, lastly, we're going to look at medication or what to prescribe. So what is usually recommended is a DDAVP or Vasopressin. So that's going to be the general medication to prescribe for patients with diabetes insipidus. Thank you guys so much for watching today's video of Medicine in 3 minutes. This has been Diabetes Insipidus in 3 minutes. Make sure to hit the like button, smash that subscribe button if you're new, turn on post notifications. We're dropping a video every couple of days, so make sure you're up to date whenever we're dropping a video. Make sure to leave some comments down below. We really like to know what you guys think of the videos, if there's anything we can improve upon, any mistakes, or if you just want to leave some positive feedback. Yeah, that'd be great. We're responding to all our comments, and we just love to hear you guys, what you guys think of the videos. So thank you guys so much, and I'll see you next week.